Welcome back to the Conscious Fertility Podcast. Today we're with Dr. Paul Magarelli. This is going to be a fun one for us because Paul, you're going to learn about, he's a reproductive endocrinologist. I'm going to actually share all his education. It's crazy what this man has done. But I've known him since 2008. We met, and we'll talk about how we met.
Yeah.
And he's really been I'll call it a force in integrative reproductive care. So we've become friends along the years. So it is a real pleasure, Paul, to have you on the Conscious Fertility Podcast.
Thank you, Lorne. And I've been also witnessed your growth, both as an acupuncturist and as a media specialist and as a healthy seminars advocate, and about someone who believes education is foremost in anything that we do. If we educate, we create, and if we create, everything is good. So happy to be here. Excited. I wish I had more books in my background. You have a lot more books than I do. Actually, I just have a beautiful cup of coffee which says Healthy Seminars here, as you can see.
Well, let me tell the audience a little bit about you. And the way we'll kind of do the intro, you're welcome to jump in. I may ask you questions because you've been around for a while in this field of reproductive medicine, and you have done a lot. So it's worthwhile letting people know who you are. And then for those that are tuning in, I always say we sometimes have really focus on the conscious work, and sometimes it's really focused on the reproductive fertility aspect. This is going to be one of those reproductive fertility aspects. And we're going to talk about integration, things you can do to improve egg quality, affordable IVF. We're just going to go through all the things that Dr. Mag has had his involvement in. But I just kind of want to share first a little bit about his background. He did his PhD and MD, a double degree, it sounds like, over at the University of Arizona. His PhD was in nutritional biochemistry and animal physiology. So hence why you're probably big fan of nutrition when it comes to health and fertility. Yeah. He is an MD, as we mentioned. Then he did his OB/GYN at Duke University. And then he went to become a reproductive endocrinologist over at an REI at UCLA in Los Angeles. So you both got the educational side of it, the science side of it, and the clinical side, which is really nice to have when somebody's seeing patients or doing education.
True.
And then I just kind of want to share where he's a little unique from being a reproductive endocrinologist. There's a big focus in integrative care, and that's because he's actually a pioneer in that, because his research has been instrumental in integrating acupuncture into IVF treatment cycles, called the Cridennda Magarelli Acupuncture Protocol, CMAP, which he co-developed with acupuncturist Diane Cridennda. And it's now often utilized globally to enhance fertility treatments. And his current academic roles include serving as the chairperson at Yosan University Integrative Reproductive Medicine Program. And you're also an advisor to the ABRM, which is the Acupuncture and TCM Board of Reproductive Medicine. And
I did that on Monday.
That was on Monday. And then on Tuesday, and I'll share that Paul shared his cup of healthy seminars. Those that don't know, I have my clinic, as you know, in Vancouver, but I also run an educational company where Paul has taught acupuncturists a lot on reproductive medicine. And he's also been part of the Integrative Fertility Symposium that I ran until COVID put the brakes on it for a while. Still planning to bring that back. And he's also been a keynote speaker as part of that. So you've been involved in this for a while. So I kind of want to go way back to kind of around 2008 when we first met. You came to Vancouver to teach. But I kind of want to share, I don't think everybody knows the story about you and Diane, because she came to you wanting to do acupuncture with your patients that are going through IVF cycles.
And when I first opened up my practice in 1999, she came around 2000.
And you're like, whoa.
I said, no. I wasn't whoa. No. It was like, whoa, and hold your horses.
And no.
No, well, but no. Because first and foremost, I appreciated the fact that we were a new field. And people need to understand, really, 1984 is where things began to percolate in the field of reproductive medicine. And 1976 is when we invented this concept of a reproductive endocrinologist. So it wasn't very many years that IVF was available, and it was crude. I mean, by today's standards, it was a very blunt instrument, not crude, a blunt instrument for dealing with fertility. And all we wanted to do was basically fertilize an egg. That was pretty much it, and get it into the uterus. And we felt that was a miracle. And as you know, it was a miracle, when it first began. And it really was oriented toward patients with tubal issues, right? It just made sense. We didn't have any other subtleties. If you can't get the sperm and egg to talk to each other, you have to make it fertilize outside the body and then put it inside the body as an embryo. So when she approached me, I just started it was my first private practice. And I've been an academic guy, Duke, UCLA. And then my first job was at Michigan State University as a professor. And, then I began to gravitate towards private practice. So I had witnessed and coming in as a scientist, science and medicine have a very different approach to things. And medicine wants to know a little about a lot. Science wants to know a lot about a little, one specific thing. And I was that crazy guy in the middle trying to do both, or doing either both great or both poorly. But the point was, science was a very big part of who I was. And then I became a physician. So when she came in and stated, and it's a saying that you see on the internet, acupuncture, it works. And, and that's like saying air, it breathes. I mean, it's too global for a scientist. So, I'm parsing it out. And I wanted to understand how. There really wasn't many publications on the how. It was more inferential from centuries of work, not with acupuncture, not with IVF, centuries working with sex. That's all traditional Chinese medicine foundation is working with sex and natural conception. How does it work? Well, it's not working. Well, take this herb, take this thing, do this meditation, eat this food, those kinds of things, which have validity in every culture. Every culture approaches it that way. But once you get to medicine, it kind of has to have a different perspective. My perspective was, and it's a quote that she and I laugh about, it's show me the data. You show me the data, I'll let you treat my patients. And even today, your patients are vulnerable to everything. It's even worse because the internet can espouse all kinds of things. So they're very influenced, people who are desperate. And I said to her, my patients are desperate to get a baby. It's a new field. We're very crude. Our pregnancy rates were 15 to 20%, worldwide. And we were the best in the world at that time.
This is over 20 years ago.
Yeah. And that was a big deal. Getting us to 15% was a huge deal. And this was the days when we did fresh transfers, day 3, sometimes day 2 transfers. No such thing as a blastocyst, no such thing as ICSI, no such thing as freezing, no such thing as PGTA. So anything that could harm that 15%, and that's the way I viewed everything, any nuanced thing that came aboard without a lot of data, I couldn't support until there was data. So that's how we met. And unbeknownst to me, Diane is very stubborn and a very willful person and a very disciplined athlete and worked with doctors before. She decided to take me up on my offer and she showed me the data. So one paper came out, then a tour and the Paula's paper, and interesting, which I reviewed. She said, will you read it? I said, of course. I said, show me the data. And of course I'm going to do it. And I had lots of questions. The physiology was we didn't have a cause in either of them. There wasn't a cause. There was an inference. Quieting the uterus, the Paula's protocol, quiet the uterus, and you won't have expulsion of the embryo, which at that time was a big reason why people didn't get pregnant. We thought was, they must have spit out the embryo after we put the embryo in. So we quiet it is a great idea. That's the Paula's. And then Senator Victorian said, well, in order to get things to work, you need blood flow. And that makes sense to me. And we have nothing in Western medicine that could preferentially do blood flow to the pelvis. That's where the action is. That's where the uterus is. That's where the ovaries are. So that makes sense. So it began to have an inkling that there was some science that might support the use of acupuncture. And that's kind of how we started.
So the point was, you talked about 2 studies. There was some data. Then you were willing to have Diana work with your worst case prognosis patients. You didn't give her easy cases.
The reason that our field is extraordinarily competitive. Reproductive IVF, let's call it IVF. It's not reproductive medicine, it's IVF. The field of IVF and the industry of IVF is extraordinarily competitive because we have to report our clinical results to a public database. And that's unheard of. Now, because we did that, if Dr. A had a higher pregnancy rate than Dr. B, somehow everybody thought Dr. A was better, versus Dr. A picked his patients that were more successful versus Dr. B, who saw everybody. So I decided after it was a year and a half of this back and forth. And I had 5 patients. I couldn't get pregnant no matter what I did. And I said, listen, I've been speaking with this acupuncturist. She's passionate about it. We've got some papers. Can't tell you whether it's going to help, but it certainly is. I can't find, and I did. I looked and looked and looked. Did acupuncture hurt anything? Anything? I mean, did it hurt hearts? Did it hurt livers? Did it hurt metabolism? I needed to understand if there was a negative side, because our medicine has side effects, goods and bads. And really, there wasn't anything that stood out to me physiologically. And so I said, here's 5 patients, many of which were very much older, in their 40s. And at that time, there was actually an ethical dilemma as to whether we should treat people over 40 or not. Very different today. And it was controversial, not ethical, controversial. And so I sent her 5. She sent back 3 of them pregnant. So I didn't even get to charge them. She sent them back pregnant. I didn't ask her to get it right, naturally, through the use of traditional Chinese medicines. And one of them, she got another baby from. Okay, now I was intrigued. And so I said, listen, if we're going to do this, and there was some inkling in the industry that this was important, or that may be important. And I said, let's do a study. And the study had to be in a Western format, which is very rigorous compared to some of the stuff coming out of China at that time. China today has become Western in terms of their publications. And we did. And long story short, first we demonstrated that those patients would have a low ovarian reserve, poor sperm parameters, poor blood flow, had a 15% improvement in their pregnancy rates and live birth rates. And it was like, well, the pregnancy rates weren't statistically significant, but the live birth rates were, which is, of course, that's the holy grail, as a baby, not just getting pregnant. And at that time, remember, I'm starting at 15%. So if I could add 15%, that was unheard of in the industry. Every year we had a 1% increase, maybe, sometimes not. And this one activity was going to give me 15%. And so we began to look at that. We began to look at good prognosis patients. We began to look at what kinds of patients, PCOS, male factor. We began to look at the mechanism by which the acupuncture would help. And it turned out it does impact hormonal fluxes during the time in which you want to get pregnant in a positive way, historically, which was corroborated by both animal studies and really ancient human studies. And then the industry took off.
And then with your paper that you did, you did a study where you combined the Paula study, and we're talking about a 2002 German publication of acupuncture before and after IVF, which most clinics don't do anymore because those were fresh day 3 transfers and now they're frozen day 5. Just for people that are listening, I'm not suggesting you run to your acupuncturist and say, you got to do Paulus on me. Most don't do it that way. And you also combine the standard Victorian, where she had the acupuncture blood flow protocol. What were the results that you found that you published with that, like pregnancy rate, live birth rates, lower miscarriage rates? What was?
You kind of said it. In other words, what we found, more patients were likely to get pregnant. Those patients were absolutely more likely to deliver a live birth. Miscarriage rates declined by 50%. Multiples, which was a big deal, multiple pregnancies, triplets, quadruplets, septuplets, etc., was happening all the time when I started in this field. I mean, twins, triplets, quadruplets were the norm.
Because you were putting in multiple embryos.
Yes, because at that time, our pregnancy rates were so low. And with acupuncture, it seemed to harmonize things so that we always got one live birth, very rarely, or we reduced multiples, I think it was by 80%, the number of multiple pregnancies, births that we had.
Because you don't want multiples. Despite the patients often want multiples, you don't want multiple because it's risk to mother and baby.
Totally. And the numbers are staggering, even for twins, 21% chance they're going to have long-term problems being a twin, mentally, physically, etc. It's cute. Everybody wants them because they're desperate again. But honestly, there's one uterus for a reason. We don't have uterine horns like in animals where when a dog has 5 pups, it's because it has 5 places for each pup. Each pup has a place to grow separate from the other pup. It's not that they're all growing in the same womb. And so ours is one womb, as you know, and that's why it's built that way physiologically. So across the board, where at the beginning, there was 1 or 2 clinics in the United States utilizing acupuncture with their patients. By the time our studies, and every single year for about 5 years, we published a portion of the studies. And now every single IVF center in the US, and I'm betting in Canada, will either recommend acupuncture, offer acupuncture, or don't resist the use of traditional Chinese medicine. So it is now part of the culture in this part of the world or North America, I guess would be the best answer. In North America, it's part of the culture that people utilize both. And my understanding in China now, there's a real push also for that combination in IVF centers, because I've been seeing some publications coming out of that.
Excellent. Now we're going to fast forward to modern times because we were
Yes,
talking plus 20 years
ancient.
ago. Ancient, very ancient. I'm going to list a few quotes and see if you remember these quotes, and then we're going to tie this into kind of epigenetics. I'd like you to talk about
Absolutely.
that. So first of all, everybody, Paul and I have had some good times. Like, you remember, actually still going back to ancient times for us. After that, 2008, when we met, 2009, we were in Austin, and that was when the ABRM, the Acupuncture and TCM Board of Reproductive Medicine started, and you're an advisor of it. And that was part of your hoping that IVF clinics could find people, at least that have taken exam, done extra studying in that area. That was kind of the idea behind it. And I share this story because maybe I'll tell the story because we've had some good practical jokes on each other. We've had in the hot tub with our good friend, the late Ray Rubio, about male factor and those poor firemen hearing us talk about sperm for an hour in a hot tub. What was a hot tub doing to our sperm? Remember? But
I do.
we may go there, everybody, if we have time. You want to hear some funny stories. But what I wanted to quote is,
it wasn't our sperm.
Yeah.
It was to the physiology of sperm production.
Yes, but because we were in the hot tub, it made us think about it. Heat and salt, right? Well, actually, I got to the question we asked. So let's see your answer for it today is one of the questions we asked. And I got to set the setting here. Is there's the late Ray Rubio, myself, Spence, and a few other acupuncturists, Dr. Magzer, and we're rapid firing him questions about reproductive medicine. And there's 3 guys on their day off at this hotel, and they're firemen. And they're drinking beer in the hot tub, and we're talking about sperm loudly. And these guys are uncomfortable.
We got them to leave. That was
yeah. They were like, "What the hell?" But one of the questions we said is, so heat can insult sperm. It can affect the motility or count. And the question is, so if a guy had a fever or was in the hot tub, does that mean tomorrow his sperm isn't great, or is it in 3 months, that 72-day spermagenesis? So for those that are watching, their husband might have had COVID, they had a fever, or they're in the hot tub, when would that heat insult impact the sperm, or over how long a period? Because men are always making new sperm, so eventually that insult would be gone.
I'll give you the classic answer, and then I'll give you today's answer. So we can be historic and today. Historically, the answer would be in approximately 70 to 90 days, you'll begin to see changes in the sperm because the heat is affecting the sperm at the level of basal cell. The basal cells are what make the sperms, which become spermatids, then spermatozoa. So it's somehow affecting the machinery of that sperm, whether it's in quantity or quality or both, it's affecting it. Today, I would say that it's at 70 to 90 days and at the time of the insult, because I think we don't have very good tools, but we didn't have good tools back then. We have a fairly good tool today called the DNA fragmentation index. It's a reasonable tool to look at the impact of the environment on the sperm and the sperm's function. I don't think this study hasn't been done as far as I know, but I would bet that if you had a person doing a DNA fragmentation study on the sperm prior to the fever, during the fever, and then a month after the fever, you would see changes during the fever in what's happening with those sperm. It makes biologic sense to me. But overall, a dramatic effect is going to be seen for prolonged fevers, not just a day in a cold, but prolonged fevers, a week, high temperatures, 103, 105 Fahrenheit. Then you'll see that effect with lowered counts, possibly increased teratogenicity, teratozoospermia, where you're seeing changes in the shape, and the motility in about the 70 to 90 days. So you're not doing anything that's perpetual long-term unless you take hot tubs every single day. Then you're going to see a cumulative effect because the sperm just don't like heat. And that's why the testicles are outside the body.
So we are going to talk about epigenetics, but I want to talk about the guy a little bit more just because we're on track with that. I actually listed some course titles that you had proposed for the IFS and some that you've done. I was going to throw them at you and say, give us a quick summary.
I have the wrong liquid here.
Yeah, exactly. I won't make it too hard on you, Dr. Bag. Don't worry. But I don't know if you actually taught this one or it was one of the proposed ones, but the title was Is it really unexplained, or is it undiagnosed male factor? Sperm's role in recurrent pregnancy loss and unexplained infertility. So that makes me think of, can you just continue then, since we're talking about the male, because often in my practice still, that I'm in practice over 24 years at this point in time, it's still majority of the women come, even when diagnosed male factor is the guy that's coming into my practice. And I don't think the reproductive field, your field, has done a very good job at communicating that it takes an egg and a sperm cell to make a healthy baby. But I think it's because men still think that it doesn't matter if they just have sperm, it's going to work, and the quality is not an issue. Does sperm impact the unexplained infertility or miscarriage?
It certainly has a much larger component today because the denominator has gotten smaller. When I was trained, it was 15% of infertility is unexplained. I can tell you that today we're probably at the 5% unexplained, and that's only because we haven't really looked at the males. We've been able to dissect the genetic components of fertility. We've been able to dissect the endometrial components of fertility. We've been able to dissect the infectious components of infertility. But what you're getting at is, if there's a male factor, it doesn't, having more intercourse or switching partners or is not going to change the outcome significantly
Wait,
enough.
switching partners would change the outcome significantly because you get new, different sperm.
No, changing the female partner.
Oh, okay.
Talking from the male's perspective,
Right.
is that the male will say, and King George said it, the reason he didn't get an heir, a male heir, so he killed a whole bunch of his wives, was because it was the wife's fault. Whereas we know now, that the male is the one who contributes the sex chromosomes, depending on an X-carrying male sperm, which would be a female, or a Y-carrying male sperm, which would be a male in the offspring. So the answer to your quick question, and just as a quick answer, is two things. One, as we evolve towards the health of the fertile person being significant, if we get to epigenetics, as being critical for those circumstances where we can explain their infertility, the unexplained, it's going to be look at the health. We have to understand male factor infertility is a marker of health. So not only is it worthwhile for the male to manage the male factor infertility for fertility purposes, but it is going to play a huge role in his long-term health. Everything from testicular cancer to longevity is being marked by a sperm. It's associated with male factor infertility, or just simply abnormal sperm parameters.
Canary in the mine, they call it. When you have male factor infertility, you as a physician now, if there's issues with the sperm, you want a full workup, cardiovascular, oncology, everything, because it's the canary in the mine that maybe something else has happened.
So it's worth it to do it for that reason for the males, although they should do it if they want a happy marriage.
Yeah.
But it's not that you said my field doesn't focus on it. We have focused on male factor infertility since we were taught infertility, which is 30% or 40% the male, 40% the female, 20% both of them. So if you look at that, it's a 50-50 deal why infertility is there. The people who get healthcare in North America, so I'm going to speak to it, are females. Men do not get healthcare. They go when they die. They go when their heart is about to give up. They go when their smoking makes it so they can't breathe. They go when they can't walk up a flight of stairs, for claudication. Men are programmed in the Western society to bear it because their jobs are hard, they're toxic, but we've always been focused that it's the male who has to provide the framework for which women can reproduce, and that's true of the animal kingdom. A lot of animals in the animal kingdom is, the male is going to provide the food, is going to provide the safety, the perimeters, protection. And we give up on ourselves when we do that. And I don't think it's any different in fertility. So when the female says to the husband, you have a sperm issue, okay, what vitamin do I have to take? Now, that's a great thing, but it may be you have to cut back on smoking, alcohol, tinctures.
Well, let's let the guys know and we know 90% of the people listening, it's a generalization, but probably are females that are listening to this. So basically, if you're in a relationship with somebody that has sperm, diet's going to play a role, lifestyle is going to play a role. Are they sleeping, the stress, exercise, toxins in the environment are really hard on the sperm. Then there are supplements that the sperm can benefit from because, oxidation.
Or diet, yeah. And there are supplements that can protect you in that from oxidation. So
Now there's some acupuncture studies. We do herbal medicine for it. And there's even some photobiomodulation, low-level laser therapy studies that have come out. So basically, sometimes the semen analysis is not going to tell you whether that sperm can give life or not. And so we usually...
It's not meant to. It is not meant to tell you that it's gonna work or not. It's only comparing you to a group that has been shown to have fertility, not every single one, but have fertility, to those that don't have fertility, and it's a screening process. It is by no stretch of the imagination does it tell you which sperm is going to work or not work. You can have a very low sperm count and make babies every day of the week, and you could have a very high sperm count and not make a baby ever because there's other factors. It is a screen, much like the pap smear is a screen for cancer of the cervix. It is not a test for cancer. It's a screening mechanism that says, go the next step. So maybe that's the point today. Abnormal semen analysis says, go the next step, which is get it evaluated so that you can understand the health and vigor of that sperm. It's only a warning sign, much like blood. It's a vital sign.
If their semen analysis is normal and they're having miscarriages or unexplained infertility, and the female checks out well, do you want the guy to get more involved? And what are the next tests? You mentioned the DNA fragmentation.
DNA fragmentation is probably the best sense to see the functionality. It's the best functional test. In the past, we actually did hamster egg penetration assays. When I had a flashback when Diane Dr. Cridennda came to my office. I remember I was building a hamster lab because we had to get hamster eggs and use them as a marker of the ability of the sperm to penetrate the zona of the hamster egg, and that was a model. So there's a functional model. Nobody does that. Nobody's going to do that if nobody does that. DNA fragmentation is another model of that. So we don't have a lot. That's the point. We don't have, other than the semen analysis to explain what's going on. We have tons of information and research which shows the impact of smoking, alcohol, drugs, lack of sleep, stress. We have tons of lifestyle, which seems like a very low level impact, having huge impact on sperm. Sperm are sentinels. The sperm itself, the reason I philosophize that the reason it takes 3 months to see the impact of the environment on the sperm is because when the males set out to find a safe place to raise the tribe, they would be ahead of it. It would take 2 to 3 months, and they would be living there and be exposed to that environment. Now they bring the tribe. If nobody gets pregnant that first month, they know that is a bad environment for us, and we have to move on. And they didn't know it as a science. They just know this has a bad vibe to it, right? And so it's a sentinel of the environment. It's telling you, is the environment safe or not? And if it's not safe, meaning his habitat, his lifestyle, his whole body is not safe, why would he want to reproduce? Makes no sense.
And there's things that you can do. So lifestyle is key. And as you mentioned, it's low level, as in, these are where I share that these small actions lead to huge results. So sleeping, diet, not smoking, moderate alcohol, recreational drugs avoid, heat and salt. And then there's other things you can do to continue to support it. So talk to your health professional about that. I would like to go back to now the epigenetic idea, and I want to bring out a quote. And this is where one day I said I have this formula. I say healthy baby equals healthy egg plus healthy sperm plus healthy uterine environment. And then you said, why don't you just call it healthy body equals fertile body? Healthy body, fertile body. Remember that? Like it just,
yes, I do. I still use it. Yeah, a healthy body is a fertile body. Yes. So
now I want to bring up a quote from the Integrative Fertility Symposium. So I got to set the stage for this. We had a panel, and on the panel we had some naturopathic physicians. We had some doctors of traditional Chinese medicine. We had you, Dr. Paul Magarelli, on there. We had a reproductive urologist, Dr. Paul Turek. And I've been quoting you, so hopefully this is correct, because this is how, people make up things in their mind, right, memory? But this is what I remember. You said in the group, because we were talking about integration and there was debate about, referrals and who's doing what. And you said, listen, what I do, you, Paul Magarelli, Western medicine, gets patients pregnant faster. And then what you do, which you referred to at the time, complementary alternative medicine, the acupuncture naturopaths, as you point to us, you said what you do gets patients pregnant better. And together you said, that's why you like integration. Let's help get our patients pregnant better and faster. And that ties into epigenetics. So can you now kind of go into why you teach at Yosan University, right? A Chinese medicine school, and you've become I think an advocate for integrative medicine. You've coined the term during the Integrative Fertility Symposium multiple times in your talks. You would call it one medicine for increased success and pregnancy outcomes. Can you kind of just share with the audience what this idea is, epigenetics, better, getting pregnant better, and just kind of talk about what
Yeah.
you see with integration?
Good memory, by the way. You weren't hallucinating. Your senility is not showing up, so we're in good shape. From my standpoint, I was evolving my understanding of the role of traditional Chinese medicine as a form of complementary medicine at that time as a teaching point, because they had to deal with reproductive endocrinologists, Western medicine doctors who are very pharmaceutical oriented practitioners, and the pharmaceutical industry are the ones who had to do randomized controlled trials the way we think about them today. They don't apply to every field of medicine. They don't apply to life, but because our minds are all about randomized controlled trials, blinded to what drugs people are taking, I wanted them to have something in their heads that would make sense in that conversation with a reproductive endocrinologist. And what would make sense is that no matter how well we put the sperm inside the egg with ICSI, if you have a poor egg or a poor sperm or both, meaning they're not functioning at peak reproductive capacity, your outcomes are going to be lower regardless of the technology. Since we, Western medicine, don't have the time, patience, ability, or structure to deal with the quality of things, we tell people, eat a healthy diet, don't smoke. Well, when I was in medical school, the people who smoked the most were the pulmonologists, the people who dealt with lung cancer all the time. Their offices were so smoky when you walked in. So, do as I say, not as I do. But with traditional Chinese medicine, in most cases, they kind of talk the talk and walk the walk. And that's particularly true for Dr. Cridennda because she's a competitive triathlete and, she's been in Western medicine, Eastern medicine. So she lives she eats right, does whatever it takes. So, and that was the person I was most exposed to in terms of traditional Chinese medicine. That's the person I was. So for me, one of the things that was confusing at that time was this thought by acupuncturists we could fix FSH, because FSH is a marker of low ovarian reserve. And if we could fix FSH, it's just a hormone produced by the brain. That's all it is. We are improving their outcomes. And I said, well, give me a mechanism. Give me something that would explain that. And they really couldn't. They would, talk about qi flowing the blood, all these things, or blockages in the flow of qi, stagnation, those kinds of things. I said, but okay, so what's the mechanism? Those are words, but what's the mechanism? I've come to understand that the mechanism by which they had very small but incremental changes, sometimes in FSH as a marker of ovarian reserve, was they improved access to where the eggs are. So that would lower the FSH, which means you have more eggs. They would create a media. The body is bathed in blood, of course, and lymph. And that media brings all the nutrients and takes away the toxins, etc. Well, if you can improve what's being flowed around an egg or a sperm cell with, let's use it easily, more oxygen, better fuel, less toxins, it is entirely likely that microenvironment would enhance outcomes. So that's a mechanism that our pharmaceuticals can't do. We just bombard the system with more and more and more of everything, hoping something happens, but we don't change the environment. So yes, we may get more eggs, which statistically will get us more embryos, which statistically will get us more babies faster. It's not necessarily that we're going to help that person who has more than enough eggs of a poor quality, or that person with really a lot of sperm of poor quality. We're not helping them. So this one medicine concept, or this combination concept, for me is make the microenvironment, and I see it very crudely, make the pool in which the egg is living and the pool in which the sperm is swimming, non-toxic, more oxygenated, have more of the nutrients that are necessary for all of the machinery in the egg and the sperm to do their job. That still makes ultimate sense to me. And that's what drives me for us to not only work together, but to ask questions and do research together. And that's what brought me to Yosan, is being part of their doctoral program to come up with research ideas, to get them to understand why I want them to understand their medicine in a Western light. That's been the biggest thing for me. And luckily for me, Diane was able to convert a lot of the Chinese concepts into Western medicine, because she did Western medicine for 25 years as a radiology technician. So she knew the language. She was able to help me understand your language about systems that are one medicine, one body, one human. We're all dealing with one human, and we're just explaining it from different points of view. So that's kind of where I'm at today.
Perfect. So we're going to go back to the game, because we're going to continue on this conversation. The game of I'm gonna list the topic and say, tell me what you mean by this, or summarize the talk. So I do remember you did this talk, and this is going to tie into what you said. One of your talks at the IFS, the Integrative Fertility Symposium, was called Epigenetics and the Mighty Mitochondria, Maximizing Egg Quality and the Health Blueprint of Future Generations. So can you enlighten us a bit about the mitochondria and where it comes from? Is it the sperm or the egg mitochondria that we're interested in when we think of embryo? Why the mitochondria is important and how this impacts future generations? Because our goal in Chinese medicine is not just the baby. We want healthy baby, healthy parents, right?
Generationally.
And you did a talk, because you did a kind of a deep dive to understand what impact integration could be having. So again, the topic was called Epigenetics and the Mighty Mitochondria, Maximizing Egg Quality and the Health Blueprint of Future Generations. So I think this continues on what you started, but can you elaborate a bit about the summary of that talk?
Well, I'll tell you what, I'm still waiting for my Nobel Prize for that paper. That was probably one of the best deep dives I've ever done. I don't know, my mitochondria were all firing at the same time, so everything was working. The mitochondria is the battery of the cell. You know, you don't have a good battery, your lights are dim. You don't have a good battery, your computer may not work at its efficiencies, and it's not slowing down. If you don't have a good battery, your flashlight is not going to work very well in the dark. So for the human cell, the mitochondria is what takes the outside stuff, carbohydrates, proteins, fats, and it converts it into a form, acetyl-CoA, that can be transported inside the mitochondria, which can provide the ATP, which is the energy currency of the cell, to allow function. And what is the function? Well, translating the chromosomes into proteins and enzymes and that allow your metabolism to work. What is the function? Translating it into energy so you can think, walk, see, talk, those kinds of things. And in reproduction, the energy, especially from a sperm standpoint, is going to be, can I swim to my target and beat all the other millions of buddies so that I can be the sperm that gets there to fertilize the egg? The egg itself is asking itself a question, is I've been asleep, and it has been for decades, because you lay down all of the eggs when you're a fetus and you never make more eggs. And those eggs are quiescent, quiet, like a bear hibernating. They're hibernating in a very low metabolic state. Well, then, and like any other biologic process, it's going to age and wear and tear. Do I have what it takes to get to be energized to the next phase, which is sensitivity to the hormones, and then the next phase, which is being available to the sperm, and the next phase is to engulf the sperm and allow it to cause that syngamy to happen, and in the next phase, division of that massive cytoplasmic ball that this microscopic seed of a sperm has come in and started changing the process. And can I do that evenly and consistently in a way that keeps the chromosomes separated? Because we start from, when we divide our cells, we want to divide equally, but there's reduction division, and there's simply mitosis, which is actual division, where one cell becomes two, and you want to make sure the chromosomes split appropriately. So there's all of these processes, and if you go back to concentrating on what would I want to look at to define this problem, well, I want to look at the efficiency of the battery in that cell. And then I would look at all the components. that are part of that. Well, it turns out a lot of the things that we look at from an epigenetic, by the way, epigenetic means that it's not chromosomal. It's the stuff that allows the chromosomes to express themselves. It turns on and off the genes within the chromosomes and it's super sensitive to the environment. So you can think of them as doors that allow that gene to work or overwork or underwork. And there are genes that will stop and start the process. And there are outside things outside of the genome, epigenetic, on top of the genes that will control whether or not this gets turned on or not. And so by changing the lifestyle and the environment, what you're doing is you're changing the on and off switches. And of course, you want to gear them towards health and wellness, right? Toxins will turn them off, maybe in a wrong way, or super activate them. A lot of cancers now are considered problems from the outside, turning on excessive activity of the gene so it can't control it. Because their whole body has a control way to look like Lorne, look like Paul, and even if we get a cut, still look like Lawrence, look like Paul, repair and restore and get back to function. So and this is what blew me away, was when I did this deep dive, I started looking at the Chinese herbs and the classification of the Chinese herbs. The general, the chairman.
Yeah, they have like which one is the king of the formula? Which one's an envoy directing other herbs to the area? Which one's assisting so it helps do a better job? Yeah.
And so now I could, because they have methodologies to look on the on and off of the genes when exposed to these Chinese herbs, and it supported that this was a general, this was an envoy. And that's what was fascinating to me, because now I have a model, the epigenetic model, which we use in Western medicine. And I have this pile of plants and herbs and other things that will, from a Chinese medicine, explain something. Both of them are treating the same thing. You can now get even more integration, more bridging of understanding. And then you get the best of the TCM world and the best of the Western medicine world, and you get a synergy. 1 + 1 = 3. And to this day, I would love to revisit that whole topic, because that's probably a decade ago. I don't know what year that was, but the Chinese in particular, researchers are hugely asking the question, how the hell does TCM work in a Western understanding of genetics, epigenetics, and processes, turning on and off genes? I can imagine today there's even another order of magnitude more information, which would help, I think, your traditional Chinese medicine doctors approach your patients better about creating formulas for today's patients, not for 2,000 year ago patients.
And I remember, I think you shared many papers on the herbal, but just because we're talking the mitochondria, there was a paper that Jane Littleton introduced me to. So this was like 2009-ish back then, where in mice, they showed the herbs that are considered yang tonics actually improved ATP production in the mice, and other categories, because we have chi tonics did not or not as well. So tying this all in, just a side question is, back in the day, in the early 2000s, when I was practicing, the clinics would say no herbs, no Chinese herbs. Funny enough, I remember once they took our patient off of CoQ10, and the patient said, the IVF doc said, you can't take any herbs. And I'm like, this is not an herb. But anyways, now they sell it. Things have changed.
And let's not bash our colleagues.
So things have changed.
These are my peeps.
Now we do herbs with patients, but we don't usually do it on their first cycle, or they don't start anything new like 3 days before a transfer, or they're halfway through their stims. But if they have challenging cases, they are open to their herbal medicine. And I'm curious, are you comfortable with patients taking herbal medicine or not? I think obviously, let's just put the assumption by a qualified, trained Chinese herbalist. But where are you at then, since your deep dive with the Chinese herbal medicine with IVF?
Do you know Brian? I think he taught at Yosan, because he does menopause, and so
Brian Grossum.
Grossum, thank you.
Yeah, he's on the healthy seminars. You actually will. The part 2 question will be uterine receptivity that you were on. So
okay, yes, we were at dinner drinking way too expensive wine accidentally. We weren't planning to spend that much money on it. Eating big steaks, of course, because that's I'm a carnivore in that sense. And he goes, Paul, you know what herbs are? And they're concentrated foods. They're concentrated foods. They're things you consume. They're concentrated foods. So if we could switch this from a herb, which we equate to medicine, to a
you equate it to like a prescription
drug, to a drug, and get to, oh, these are just concentrated foods, then there would be no objection, because we don't, in Western medicine, we don't have an idea about the impact of foods. So if we just say these are concentrated foods, I'm giving them a group of concentrated foods that are found to be nutritious. What is nutritious? It gives energy to the cells. It gives required products to the cells. They could be essential nutrients. They could be just protective nutrients. So I like the idea, and he and I are going to do this, by the way. We're going to do a talk on that. And I'm going to develop a statement for ASRM, which I already actually started it, about herbs are concentrated nutrients. Let's move on. This baloney about worrying about the herb doing some medical malfeasance to the stimulation protocol is like worrying about an ant interfering with the sledgehammer.
You take the acupuncture side, and I'll do the Western side.
Okay,
We'll have to
sure.
switch. I'm going to challenge you on this. I would think then, from a Western medicine perspective, these are things they've said. One is, well, they're estrogenic, so it'll mess up with our cycle. They'll say that, which I don't agree.
Okay, stop. But I want to go through each one of them.
Yeah.
You wouldn't give it. So in other words, I know the menstrual cycle. I'm board certified, ABORM certified. I study traditional Chinese medicine. I work with. I'm not going to give anything that makes counterintuitive sense. That's why you must see someone who's licensed as an herbalist. So because they have to know whether it's estrogenic, progestogenic, androgenic. There are times when estrogen is fantastic. You may want to do that for a patient who you can't get the lining to grow with your chemicals, but I could get the lining to grow with the herbs. Yes, you wouldn't give a chemotherapy if you had a cold. You wouldn't give that drug if a person just complaining of a cough. So why would I expect an herbalist to give a chemotherapy for a cough? He'll give cough syrup. So my answer to that is you have to trust my education as much as I trust your education.
You acupuncturists talk too much. All right, let me go on to my next question.
That I agree.
Well, you said they're concentrated foods, but our drugs are basically isolates from food as well, and herbs and supplements. That's where our drugs come from.
Fantastic.
They're like drugs.
So then we both agree. You have some drugs that I have no access to. I have some herbs that you wouldn't for the life of you understand, or even understand the mechanism, because that's not your training. So you use your tools. I'll use my tools for the health of this one patient.
All right, I'm going to have to tell my associates at the clinic not to work with you anymore. That was our herbal question. Shout out to Brian Grossum. Let's finish off a little bit on the mitochondria, and then we'll jump to uterine receptivity. So the mitochondria, I remember you're talking about it was like a foreign DNA. And,
yes.
And the thing
virus.
In Chinese medicine, one of the acupuncture points called Zigong is known as baby palace. It's just, and that's the point just kind of located above the ovaries. And the big part of what we think we're doing is we're supporting that environment. In this case, we're supporting follicular health. So can you then continue on this idea of epigenetics and hopefully optimizing that egg quality through how we're supporting the follicle and blood flow? Like, is this why we care? If we can bring more blood flow to the follicle, are we affecting the mitochondria of the egg, or are we affecting the mitochondria of the follicle, which is then going to charge the egg?
Okay. The answer is always yes to that question. In other words, there's no delineation. This is, and again, I'm going to wax philosophical for a second. When I'm dealing with insulin resistance, right? We're talking about food that comes from the outside and goes to the inside, right? That's what we use that term. It goes in the stomach and then it gets absorbed. What's outside? What's inside? Well, inside is every single cell in the body. Every single cell. You may have a headache, and I take some aspirin. My toe is going to get better because I have a little bit of arthritis in my toe. That medicine is going to be distributed to every single cell, and every single cell knows its location and function relative to every single cell in the body. So if you have a disharmony here, which you guys talk about a lot, and and you put in, I have a toe problem, and Diane puts needles in my thumb, my toe feels better. And I started laughing because it makes no sense, but it makes absolute sense if you think of the inside of your body as a unified whole or a soup. It has a lot of ingredients, but it's still in the same broth. And that broth will be this, and it doesn't differentiate except for the scrotum and the brain, where it has the blood-brain barrier where it's segregates, and maybe the placenta, which is two organisms. But pretty much, we don't have parts of our body that segregate components of the blood, serum, lymphatics, etc. So when you say, does it help the follicle? Of course, because if I energize the follicle for it to produce, that's, by the way, where your estrogen, testosterone, progestins, and all come from. That's a good thing for pregnancy and for outcomes. If now we say this, when the follicle's asleep, it's in a almost a zero metabolic state. It's sort of estimating. What?
It's dormant.
Right, but that's too powerful a statement, because we really can't separate out that cell. If that were true, we could take that cell and put it on the table, and it would do just fine 40 years. But there's got to be some, and again, I'm hypothesizing, and I'm sure it's written, I just haven't looked at it. There has to be some talking to the body about that particular cell. What the hell is it doing there? Is it a parasite? Is it a bacteria? Why is it just sitting there? Or, well, this is a really important cell. Let's make sure that it's warm and cozy and it has just enough nutrients and it has a little bit of metabolism. Let's get rid of the waste. So in my mind, one body, one medicine. Traditional Chinese medicine thinks in this way that it's a whole, and we deal with the whole person, not only the person, but the person's environment, not only the person's environment, the society in which they live, not just the society and the world they live in, not only the world, but in the universe they live. That kind of hierarchical look at their medicine. Translating that to Western medicine, it would be simply that every cell has a function. Those functions are integrated into a whole, and they each in that whole are impacted by the other disharmonies or diseases or malfunctions or poor blood flow or toxins, and that everything we do to enhance that one whole, we would be able to see improvements in outcomes. Now, here's a big point before we end, and this is a big point. What Western medicine does, it gets from 0 to 60, right? It doesn't get to 100. We never get to 100 in our pregnancy rates. We haven't. What I see traditional Chinese medicine is getting us in that person who goes from 0 to 60 to 70, not from 0 to 70. And that's a point of contention. And that's because we're a hammer, we're big, we were massively pushing the system, which may or may not be helping our society, but we get to the result the patient wants. What happens sometimes is there's this impression that without acupuncture, you're not going to get pregnant. And I want to change that. We talked about healthy body, fertile body. We're now talking about every cell is every cell. One cell is part of every cell. Working together will get to the outcome better, faster, quicker, with a healthier outcome. But don't expect it to go, and I see this with patients who get really mad. I did what you said. I did acupuncture. It didn't work. I said, that's not the mechanism. If I add acupuncture to this protocol, I'm hoping for a 2, 3, 5, 8% improvement in the population. But for you, it's still a yes, no question. You are or are not pregnant. That's it. It's 0 or 100. So,
I mean, when you've used human growth hormone in everything you're doing is to help optimize, to give them a better chance. But like you said, on an individual basis, it's either going to work or not. There is no statistical for you. It either works or not. But going into it, these are things that we can do that has shown in a general population to support. And now you make the decision whether it's worth the time and money investment.
But if you look at a longer view, that group, not you, that group who did the acupuncture, that group were 15% more likely to get pregnant and have a baby.
Right.
Versus those that did not do it. You may be the lucky one, it works great. You may be the unlucky one, it's not impacting your need because we don't know what your need is.
Here's just because I want to support the field of Chinese medicine because it deserves it in my humble opinion. When you go through an IVF and it doesn't work, you don't say that was worth the money. I feel great. When you go through the acupuncture 3 or 4 months and you don't have headaches anymore, your bowels aren't constipated or diarrhea, you don't have the rash, you don't have terrible menstrual pain, and you don't get pregnant, you're disappointed you didn't get pregnant, but most people are appreciative that they can now sleep and they have better health.
Yeah, you have a much easier job than I do.
Absolutely. Because you're trying to overtake the body. You got a very, and on a serious note,
Yeah.
with respect, as you know, I'm a fan of integration, so I
Mm.
never complain about the other medicine or try and beat it down. You know, without Western medicine, we're all dying at age 40 still, right? You know,
Right, right.
right,
Great,
from a
great.
couple hundred years ago. So, you know, I like it for that reason. So the integration is powerful, and your medicine's difficult because you're trying to mimic the body, which is a crazy system. My medicine is I'm trying to support it. And I always use that nourish the soil ideas. I don't tell the plant how to grow. I got to pull out a weed, I add a little fertilizer, I add water, and then I say, go. Right? But you're trying to
hybridize the grass. I've got, make it resistant to pesticides and blah, 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 blah.
convert the sun to photosynthesis. Like you're trying to be God. It's pretty difficult. So no, thank you for doing what you do. We're
Thank you.
getting close to wrapping up. So I have a few things I wanted to check on. One is we did a talk, and I don't know where we did this talk, but we did a talk together. Thank you for carrying the load because you did most of it, um, as usual.
You got to tell me what talk this is.
We talked about conditions Western medicine needs CAM help. What
Yes.
conditions Chinese Western medicine needs Chinese herbal medicine? And back then, this again is easily 2014, around there.
Yeah.
And back then, you thought PCOS, male factor, and endometriosis are things that you really like to see help, that you think it's a good integration. I'm just curious, now we're in modern times, what do you think about that integration when it comes to PCOS, male factor, endometriosis? And if you have a response to that, kind of what's your thinking and why?
Sure. Using the word syndrome, anytime there's a syndrome, ovarian hyperstimulation syndrome, PCOS syndrome, chronic pain syndrome, endometriosis. It's a disease, but honestly, we're still questioning its origin and how it spreads, etc. All of those remain conundrums for Western medicine. So we patch them, we put Band-Aids on them, we charrette them, or we cut them and then we sew them. So yes, I continue to absolutely believe that the TCM profession in a Western market should concentrate on these huge ailments. We can't, I'm not going to do the political statement here, but infertility is like 0.000001 of the medical problems in any society. It has no, it only is important to the individual. It's not important to society at all. It just, infertility isn't. That's not an issue. It's in the person, the individual, the family, the clan, but to a population, those people you put on an iceberg and you float them out. They're not reproducing, and that's how society evolved. If people were infertile as a major part of the society, there is no society. So we attacked the traditional Chinese medicine, because it was there, and it for many of them, it became a very lucrative business model to be a part of their medicine. The part that's really needed is the patients with PCOS, about 50% of our patients. Patients with endometriosis, about 15% of our patients. Patients with fibroids, patients with chronic pain associated with the endometriosis, male factor. But again, male factor, I would put that aside. Male health, I might say a little bit more, but let's put the male factor fertility aside. But endometriosis, PCOS, recurrent pregnancy loss, that's a complete unknown. We still have debates on what that's all about. And anything that's like that, that's obvious and measurable in a population of farmers where TCM evolved, that's something you can help Western medicine deal with. And so I would emphasize that that's areas where this integration and collegiality, and in my role at Yosan, and by the way, I may have a new role, clinical dean there. We're working on that process right now, is to lead the research, lead the integration, lead the education, lead this, in this pathway of evolving a much broader role in women's health. And again, it's not men's health, women's health, where traditional Chinese medicine, lifestyle management, functional medicine can begin to attack these issues that have really not changed for decades or maybe half centuries.
Not so much rapid fire, but I have my last few questions, talking points
Okay.
for you. Thanks again for spending this time with
Oh,
me.
yeah, it's fine.
We did a talk with Brian Grossman and Julie McCormick, and you were at the end, we're discussing some of the stuff around uterine receptivity. Just curious if you have anything you want to share of our listeners again about integration and uterine receptivity, if you can remember what you were kind of sharing, and you had to cut it short because a call came on, which you prepared me that you may have to, but can you touch on uterine receptivity using what you can remember from that talk and what had you excited?
The fundamental thing about uterine receptivity, we are dissecting in terms of uterine receptivity, the factors responsible for the open and closed door policy that the uterus has for implantation. It has an open door and a closed door date, relative usually to the inclusion of progestins in the body from a corpus luteum in the natural cycle and from progesterone when we give it exogenously. And we have begun to dissect the on and off of the genes as being associated with the modifications you might have for individuals to enhance their fertility because for whatever reason, their genes open the doors a little later or a little earlier. And what I was suggesting to Brian, and I don't know the answer to this, in your herbal formularies, in your acupuncture protocols, if you could put on the hat of this idea of turning on and off genes, which again, we talked about the epigenetics, and turn on or think about time. What in traditional Chinese medicine is time-dependent care? And if you can figure out a time-dependent illness or disharmony, maybe it's psoriasis, maybe it's seasonal allergies, whatever the hell it is, and look at your medicine as working in a time-dependent fashion, then I think you could begin to ask the question, what's going on in the uterus, and improve uterine receptivity, or ask the question, what is it about the timing that we can influence? And if you can, that may be augmentative or synergistic with what I'm doing about my uterine receptivity in a very crude way. That was the aha moment for him, and for me, about again, another way of bridging the integration. And it takes work on your part, and maybe there are experts who can answer this quickly. What traditional Chinese medicine is time dependent for its functionality, and what in traditional Chinese medicine can influence the timing of a disharmony. That's for a physiologic process.
All right. So you got a question, which makes us think, but not an answer. I was looking for an answer, Paul. I do know there's that, I think it was a TENS or electrical acupuncture study where they did see HOX-A10 shifting, which is the handshake between embryo and the uterus. And then I think it was in one of your talks where you brought up the herbal paper about the herbal formula in a stimulated cycle where they showed increase in pregnancy outcomes when they were doing fresh transfers.
Yeah.
So back in the day when, full circle here, when Dr. Diane Cridennda came to you, you said, whoa, no, there's no data, no evidence. And people in your field said, look, you gotta, show us the evidence, show us the data. And then over the last 20 some odd years, there's been data. Then a lot of people in your field said, well, we don't like the data when it showed it was positive. They loved it when it showed it was negative, mind you. Then the study was good. But if the study was positive, it wasn't a good study. My question is, how do you respond now when in 2024, when we're recording this, late 2024, if somebody says there's no evidence that Chinese medicine or acupuncture can support reproductive health?
Well, the answer is there is evidence, whether you like it or not. There are papers published using randomized controlled trials, which I don't think, blinded trials, which I don't think are a good model for acupuncture, for that modality of medicine. There are excellent meta-analyses that have looked at this from every which way to heaven. And then I just ask them, or I comment that, do you know that we have been studying Clomid for more than 60 years, more than 5,000 papers, and there's still controversy. So if you want incontroversial or non-controversial data, then we'll never have a conversation because I can't find that in Western medicine. 50% of most publications Now, when we look retrospectively, the data were fraudulent or they were not accurate. Their interpretation of 50% of the medical literature, Western medical literature, is now suspect based on a variety of new ways of measuring accuracy. So we are doing the best in fits and spurts, and we're doing the best in groups. We're doing the best in populations to understand what could help some, not all, yes or no. So I'm never going to say it is proof. It's a scientific method, and science by definition means it changes over time. Science does not mean it's irrefutable. It just means we looked at it, we studied it using the models we had and the mechanisms for accuracy and removing bias at that time. And 10 years later, it could be the exact opposite. So we're in a process. Does it harm is my first question. Was my first question. It's still my first question. I can't find it harming. I can't.
Yeah. And the evidence, as you say, there is evidence, and nothing is, even in Western medicine, there's very little of solid, black and white, irrefutable.
And it changes. Yeah.
It changes.
It evolves.
And then in your practice, because you had your practice in Colorado, then you were national working with clinics. Did you still up until do the transfer day acupuncture? Was that still something going on in the IVF centers that you're?
Yep. Yeah. They still are. They still are. I don't know of people who are not doing that. Some you seem to know that, but I don't know that. The people that I interface with still do that, who are on the board and who created the board. But if you talk to them, they would much like to have more, and you have to have the right practices. So in the practices that I have, we told them a minimum of 9 treatments, not just 2.
Let's talk about dosage, because we're on site in Vancouver and we have people that do before and after, and we're always encouraging getting a series of treatments before. But your data and the data you looked at, there is a dosaging that you saw results.
Yeah, it's like physical therapy. You can't go once. It teaches you something. Acupuncture teaches your body to be well, or how to be well, or it encourages it to be well. The multiple interfaces with the acupuncturist teaches you how to change your lifestyle, because acupuncture is not just a needle; it's a system of medicine. That's why I don't like the titles of my papers. I use the word acupuncture. It should be acupuncture protocol, right? That was a better use of the word of the concept. So we found that we got our best effect, where it's a statistical test. To get 50% of the people who were going to get pregnant, they needed a minimum of 9 treatments, which was the Cridennda Magarelli Acupuncture Protocol, which was derived from the Paulus and the Steno Victorian. So we took that, modified it, and then we moved with it. So yes, it's even like people who do sports, you can't win a race just running once. You're not going to win a marathon running once. And if you're dealing with the physiology change, which we are, healthy body, we're not dealing with fertile body, we're dealing with healthy body. All of those interactions need to be coordinated, and it takes time and focus and pursuit. And so I always recommend that there's a broader look at the role, healthy body, as enhancing your fertility, and being a healthy body takes persistence and perseverance.
And we did a chart review where we did on site the acupuncture with laser acupuncture, and it trended. It was 2 years of frozen transfers of genetically screened embryos. So we knew less chance it was the embryo issue. And the people that had the laser acupuncture on site had a higher pregnancy rate, lower miscarriage rate. And then it was just a chart review. So we didn't, put them into groups or categories or diagnoses. Then we looked at the patients we knew, because we don't know if they were seeing other acupuncturists, but the patients we saw, if they did a series of treatments, at least 7 treatments, then it was even a higher pregnancy rate, lower miscarriage rate. They did a series of treatments leading up to that transfer. Dr. Mag, I always thought of you as an educator. Like you really explain, educate, and education can be really empowering. You've taught on healthy seminars. You are involved at Yosan. And the other thing as a teacher is you've always been an advocate for affordable IVF. What's up with you now? What's happening? Because I think you talked about this technical conceptions company, and what are you doing for the field of reproductive medicine? What's your role now? Not what are you doing? What have you done for me lately? Idea, but what are you up to?
It's an evolution. I have been in academic practice. I've been in multiple REI practice, where there's a group of us. I was in private practice for decades. Then I was in international practice, working with the Chinese and my practice in Colorado. Then I was a national practice working with a private company. As of now, currently, I'm in a national venture capital company, and it's all, and as of October 7th, I'm changing that trajectory and pulling back. And I want to be more agnostic, more available to all of the industry rather than a specific employer. So I'm going to utilize my company called Technical Conceptions, and I'll get the website up soon. Its goal is to train and educate gynecologists, advanced practice providers, executives who work in the field of fertility. And that's part A of Technical Conceptions. Part B of Technical Conceptions is to be an accessible per diem doctor so that people who need to go on vacations, because I've got medical licenses in about 20 states, I can support them. The big arm of what I'm going to be doing is creating a reproductive endocrinology and infertility consortium, where I'm going to be supporting educational projects in multiple competing on a gross level companies, but not locally. So they're not competitors in the local market. They just happen to be in the same field, to allow them to have a cost-effective way to train new staff. And then, as I mentioned during this talk, is right now, Yosan and I are working on me becoming the clinical dean at Yosan University, because Yosan University is now an enviable position of being really the leader in the world of integrative reproductive medicine. I mean, in the world, there's no other places that offer the degrees and the education, et cetera, that Yosan University. So to all my ABORM members, get your DAOM. In other words, go back, learn. It's an opportunity, always learn. But we're going to be continuing and enhancing it. And this is going to be a first, we're going to build the first reproductive integrative medicine clinic within Yosan. And I will be seeing patients with the faculty and the students at Yosan to coach them around how to best be a patient and how to get the most out of their care. That's kind of a thing we're working on right now. So I'm very excited. Everything's going to start January 1st, because after October, Diane and I are going to take some time in New Zealand and kids and family and recharge. But so I'm going to be doing a lot more seminars, so we'll talk more about, I'll have the time for that. I have to update a lot of the seminars that you've had. I mean, they go back almost 15 years.
Some of them, yeah.
They're good, they're solid, but I want to make it contemporary and effective. We are going to be doing symposia. We do one every year at Yosan, which you've been at and certainly talked at, and appreciate that. So it's really an opportunity to me to take education to another level, to finally help. And by the way, my reasoning for training gynecologists and APPs in my field is to make access to care affordable. So it keeps coming back to, how do we make it affordable? And honestly, getting more people able to do it and more practices able to provide it will enhance access, which tends to reduce the costs.
Excellent. I love it. I just enjoy following you and seeing what you're doing. As you said, the evolution, and it kind of mixes your two passions. One is you love to educate. We see this in your educational background. You did the PhD side of it, and then you went and became the physician and an REI, and affordable care. And now you're going to find another way to make things affordable. So thank you
And
for
integrative medicine.
integrative medicine. Yeah, a big. And so we thank Diane Cridennda for coming into your practice and said, I can help your patients.
And she ended up doing that. Exactly.
She ended up doing it. So thank you very much, Dr. Mag. I really enjoyed our
Lorne,
conversation.
it's always my pleasure. It's my pleasure.